to introduce yourself to the doctor and tell your, if you have any kind of queries, we can start with it already.
Sorry, I thought you were talking to Sarah and that. Yeah, I'm Joe. I got RRMS, was diagnosed last year. I just popped on because I'm nosy. That's all. I have no questions as such, but just thought I'd join in. That's all.
Okay.
Excellent.
So if you want, I can proceed with the questions. So some of the people have been writing me personally and has sent me a few questions. I can go and ask you that first, doctor. So one question I got from a lady who is pregnant as of now, and she had raised some queries, and she said with MS and pregnancy, how safe it is to regularly do the workouts, because she will be stopping her medicines also as prescribed by her doctor. And now with the stopping of the medicines and not knowing where the MS is going with the pregnancy, is it safe for her to work out?
Yeah, 100%, because a lot of times with pregnancy, as the individuals gain weight, it can cause like increased low back pain. So really the most important thing for anybody is to stay active during the pregnancy. So I would definitely say it is 100% safe. And just kind of continue on, because the later stages of the pregnancy may be harder to exercise. So, to be like immobile for 9 months is a very, very long time.
Okay, so a person has to be active even during pregnancy. Is there any kind of specific exercises that a person should do? Should it be light, or the way she has been very aggressive with her exercise all this while?
I'm focused really more so on core strengthening to kind of stabilize the low back.
Okay.
Sorry. Yeah, so really more core strengthening for the low back, as that's going to really kind of stabilize everything.
Okay, so it's mainly for the low back. Okay. The other question that I have received is from Nani. Her username is Nani, and she has written that she has heaviness in foot since not the foot, the entire leg. Sorry, her left leg is what she is saying that has been very heavy. She has been showing to doctor, but she has done her MRI. There has been no relapse, but her leg is quite heavy, and slowly probably the heaviness is even extending to her left arm simultaneously. So she has this question and she wants to know what can be done in this case.
And this is all brand new for her, like first time?
No, she had this thing last time when she had a relapse, but right now when she did her MRI, there is nothing like a lesion or any kind of relapse.
Right. I mean, that's a harder question to answer, because everyone's so different, they present so differently. So I would really just try to exercise, try to do like the range of motion. It could just be getting more and more fatigued. Even though if there's no like relapse, it could just be increasing fatigue, whether it's from weather changes, or it can be from just certain foods that they may be eating. Really trying to find out like what the trigger is of that increased heaviness, and trying to kind of target it from there. If it's like a nerve symptom, so if the nerve is causing the increased tension, I know last week we went over some of those like nerve glides with the arm kind of extending and the wrist extending. So if it's a nerve inflammation, you can definitely try to reduce that with some exercises. If it's more of like a fatigue thing, then I would really try to see like how is she regulating the sleep, how is she eating, and really try some gentle workouts with that.
Probably. Okay, so I'll do one thing and I'll ask her to also contact me. The last time when she sent me the audio message, she was like really in lots of pain. I could understand her pain from her voice. So
right.
For once, she could not join us today. However, I asked her to join. Hi, Claire.
Oh,
We have more people joining us slowly.
Can I ask a question for a minute? I do a lot of running, and this is why I got diagnosed, because I kept falling. But when I go up to pick my little one from school, at the moment we're not doing, is like about a half a mile walk up to the school and like half a mile back. When I get halfway, I get this really bad pain. It's where in my kidneys, but it's nothing to do with waterworks. I've got to stop and it'll go. But if I'm running, I don't get any of this pain. Any ideas on what it could be? Because I get it when I'm in work as well.
you get the discomfort when you take a deep breath in?
No, it's just when I'm walking, it's just like like a knot, like really bad pain. But it's in where the only way I could describe it is in the middle of the back, but on the side. But I
And
don't
it's,
get it when I'm running. If I go running.
yeah. I mean, a lot of these, it's very difficult to kind of answer these questions without actually like being there to evaluate it, because, you know, everyone, it would be more so like on a one-on-one. So if you can, you know, if you say that you twist one direction, you feel it, or if you bend backwards, or you kind of like breathe in heavy and you feel.
If I stop, and I know it's a weird thing to do, but if you stop and you like cut you down, like forward as if I'm going to touch my toes, then it stops hurting as much. Or if I stop and rest. So I just don't know what it could be, or, you know, I don't know whether, because like my MS nurse said maybe it's something to do with something called the MS hug, because people get that in different places, but I don't know because it's all new to me. So I'm not quite sure.
Yeah, I mean, it's really, if you can figure out, so if you're saying that you bend forward and that pain reduces a little bit,
It is a bit,
then
yeah.
it some of the muscular tightness or tension from the lower back. So I try to do like some kind of stretches like a child's pose, or if it's like on the left side, you can bend forward to the right.
Yeah.
And hold that stretch for a good 20 to 30 seconds, because that's going to
Right.
stretch out the back muscles.
Okay.
So if you can forward and it will help reduce the pain, then you want to try to kind of make that into a stretch for home.
Right.
But, you know, the reason why I asked if you take a deep breath in, if that hurts, because sometimes that could be a rib issue.
All
Like
right. Yeah, I understand. But
so,
no, it's just, no.
or if like twisting one direction versus another causes the discomfort, then that could be more of like a spinal issue. But if you're
Yeah.
that bending forward reduces the symptoms, and I would just try to do some prolonged stretching within that position. And
Okay.
whatever side it's the pain or discomfort is on, you can stretch your body to the opposite way, so you get that on a kind of like a stretch.
Yeah. I haven't had it for a while because of, you know, like with the little one not being in school, like I've been doing early running and I've been doing lots of home cardio workouts, which has got a lot of stretching. And I'm quite fit anyway. You know, I do a lot of exercise. It's not just a little bit. You know, this at the moment is really killing me where I can't get out. Well, I've forgotten the name of the lady in the corner. I've just sent her a video of me with my alley running, and, you know, but for me not getting out, I'm not getting the pain, so I can't really, you know, understand why I'm only getting it when I'm walking up a hill of a half a mile, when I run half marathons and I don't get it. You know, I just don't understand.
Yeah, well, when you're running, your adrenaline is kind of increased. So you might have the pain, but just not really be focused on it. Whereas
Maybe, yeah, could be.
once you're stationary, everything could be tensing up, and you could be kind
Yeah.
of. So definitely, it might be a muscular issue that you're experiencing. I would definitely. I don't know where you live. Trying to therapist or chiropractor near your area that kind of works with patients with MS. Try to kind of help work on that for you.
Okay.
But if you're stating it, it does sound like it's like just a muscular issue.
Yeah.
You know, and it works itself out with exercise, which is a good. Sometimes people exercise and increase symptoms. So the fact that you're able to do exercise,
Okay. Okay, then. Thank you.
you're welcome.
Mary has sent a question on the chat. Okay, he has written, how often should you exercise and for how long? I know everyone is different, of course.
Yeah, I would say, I mean, some sort of exercise for everyone. I recommend doing something every single day. You know, they recommend not to like work out the same body part 2 days in a row. So, you know, if you're doing hip strengthening workouts one day, then maybe do more like for the second day. I would try to incorporate a bit of that. Like a lot of my patients, I treat a lot of my patients for a while in my office, but then from that point, we try to give them a very specific program to do for home. And my recommendation is see what like works best for you. Some people like doing full body every single day. Some people get really tired from doing legs one day, so they could do like legs, arms, and then core, and then kind of repeat that cycle. So you're doing 2 to 3 times a week of your legs, arm, and core. But in general, I would say some sort of exercise every day is beneficial. And if someone is just starting out with workouts, then you want to kind of start off nice and gentle. Don't just go out and do like a full hour your first day, because then you might feel really fatigued the subsequent day. But try to start out with something gentle and see what program works best. But always incorporate the hips and ankles, because that's going to be responsible for the balance. Always incorporate some core, some arms, and then a little bit of balance workouts. So like some easy balance ones could just be standing with your feet together, standing with one foot in front of another, standing with your arms crossed and trying to kind of close your eyes, but make sure you have something near you for support. Some higher level ones could be like walking on your heels, because a lot of individuals with MS develop foot drop. So you want to try to reduce that kind of, you know, foot drop by trying to walk on your heels. And that's a pretty tough balance exercise on its own. Walking on the toes. I love giving my patients to do side stepping, because that works the hips, as well as some backward walking. So everyone's used to walking forwards, but backwards walking is going to target the glutes as well as challenge the balance for you.
Okay, I've got a question. My physical therapist, Dr Gretchen, she did some health bespoke advice for me a couple of months ago, and I tried to do her exercises.
A couple of months ago?
Every single day I try to do it. I think I've missed over the past 12 weeks 2 days because I had migraine. So I do the same exercises on my legs, because that's where I have my most prevalent symptoms. So I kind of don't even know how to describe it, fatigue in my legs when I walk. So I'm doing kickbacks, kick-ups, and then toe lifts, and then exaggerated steps. So it puts all of those bite-sized piece exercises together. So I do 5 minutes of steps in an exaggerated way. So that routine takes me about 30 minutes a day, and I've been really sticking with it. And for my average scores, because I keep a spreadsheet, I know it sounds sad, but I'm quite analytical. So I track my scores and I track my averages. But am I overdoing it? That's the question. I feel great, but that's the question. Am I doing too much? And I do my steps every day. I do a 45-minute walk. I did about 55 minutes this morning, which is amazing, because I don't usually walk that far. And I usually do, I'm not doing yoga today because I'm doing the call, but 6 times a week I do around 45 minutes of yoga as well a day. So I'm maxing out on the exercises, and I'm wondering whether I'm overdoing it, but I feel great.
Yeah, kind of that simple topic, and if you're feeling good, keep up with it. I would never tell anyone to do less, because I think you were saying something about like 20,000 steps a day.
I did 25 yesterday.
Yeah, so if you're feeling good, keep up with it.
Yeah, I found it really something that I can manage and something that's easy to do. So my morning walk this morning, I did around 6,000 steps, and then the rest of the steps, I gradually accrue them through the day. So it's something that I can control and I enjoy to do. So I'm not going anywhere except the garden or the house. So it's something I can achieve and I can manage. But I just wanted some advice to see whether I am overdoing it, because, you know, I don't feel like I'm putting anything at a strain. I don't feel hugely fatigued unless I walk for over an hour at any one time, then I'm in trouble.
There's some background noise there. You guys are not, if you just like mute yourself, because we hear a lot of like clicking of the,
Sally. Hi, Sally.
that way we can just kind of have a clear conversation.
Yeah,
Sorry. But yeah, I spoke about that last week, and I would 100% say if you are feeling great, keep up with your activity level, because there's no sense to reduce it. I mean, just keep doing what you're doing and keep those muscles as strong as possible.
Okay, thank you.
Now, I know last week we had some conversations. A really good question was, you know, what kind of workouts should we do post an exacerbation? And whoever wasn't here last week, we said that we would start rolling out like a thing for MS Mondays. So if you guys have certain things that you're, you know, because some of the questions might be very difficult to just kind of explain verbally. So we came up with about 6 or 8 exercises that we displayed last Monday, and we'll be coming out with the second one this coming Monday. But if you guys have any questions about like what certain workouts to do, what certain body parts, those would be great questions, so we could try to compile some video footage, and then everyone can utilize that to check back into.
Right. I hope you guys have seen the MS Monday video that was posted by Doctor. So
Yes.
those were the really good exercises that I think, you know, we should remember and keep in mind. And whenever we have any kind of problems, we can do it. So we'll be anyways following up with other exercises also later on. Does anybody has any other questions?
Yes, I've got a generic question. Is there any oil or an ointment, doctor, that you can suggest for muscle pain?
So it depends. There's like millions out there, and everyone responds differently. So I don't have a specific one, because there's, you know, like thousands of different CBD oils. There's thousands of different like massage creams. A lot of individuals like essential oils that kind of help relax the muscles, but it's more so to figure out what is the specific muscle that is getting tight. And if you could give me that, then we could kind of show you some stretches to help relax it. But in regards to like a specific cream or oil, I don't have a specific one, because everyone just kind of finds, you know, relief with different ones.
You know, so this way I mostly use point relief. So point relief is something which really helps me. I'm not sure how many of you guys use it. So the ones like Wanley and all, I think point relief is really helpful. I think that's the one which most of the physiotherapists think. Doctor, the other question I got was, I think the person was an athlete. So he said that what about the the taping therapy that doctors provide? How effective is taping therapy for any kind of pain? Can that also be used for MS pains?
Like kinesiology taping?
Yes.
Yeah, so actually I teach that quite a bit within the US. So
Yes.
a lot of patients like with ankle pain or knee pain, because what happens is individuals will utilize like a brace or an ace bandage, but that becomes very bulky. So if you were to brace a wrist, you're not going to have the ability to kind of flex or extend. Same thing with a thumb. You're not going to have the ability to bend it. So I use kinesiology taping quite often, because what it's going to do, it's going to support the joints, going to help provide pretty immediate relief, but it's also going to allow the joint to be flexible. Because if you just kind of splint something and you don't allow it to move, you're going to develop a lot of scar tissue and loss of range of motion. So I highly recommend the kinesiology taping.
No, but if a person doesn't have any kind of joint pain, but the pain is on the back probably, or on the hand, on the wrist, you know, those portions for MS pains, if that's what the question is. Specifically for MS pains, is it useful?
Yeah. I mean, everyone has different types of pain to reduce like numbness. You know, it matters what type of ailment they're working with, but you definitely can use it for all of that. For numbness, you could use it for swelling, you could use it for joint support.
Okay, thank you.
Doctor,
Okay, I've got a question.
Yeah.
yes, I'll.
Oh, right.
Hello.
I was, for MS, a very, very active person. In fact, I've had MS 8 years. 3 years ago, I ran, walked, and wheelchaired the local half marathon for
Okay.
charity MS research. But because of this pandemic, I'm not even allowed outside my front door. So what can I do?
To do what? To go out. I'm sorry, just repeat that question for me.
I was a very active person before
Right.
MS, and then I had MS 8 years. 3 years ago, I ran, walked, and wheelchaired the Bristol Half Marathon
Right.
for the charity MS research. But now, because of this pandemic, I'm not even allowed outside my front door. What can I do, exercise-wise?
Yeah, so I think we discussed that last week as well. I mean,
I wasn't there.
say it again.
I wasn't there, I don't think. Oh,
Okay.
maybe it was.
You weren't? I
I
think
can't
okay.
remember.
Yeah, I mean, there's so many different things. So we posted the video what you could do with the legs, simple things like going for a walk outside.
I can't do that. I'm not allowed out of the house.
Okay, so you could do
It's on
things
high risk.
just stairs at your house. So going up and down the stairs, that's going to be a form of exercise. Sitting and standing from a chair, doing some, core workouts, laying on your back, doing some
Like that.
bridges. We made a video last week of just I think it was like 6 or 8 exercises that you can do without any equipment. But really, you can do so much around the house. You can take, if you have weights at home, you can work out with the arms. It's a very general question because you can do millions of things around the house. So the video we posted last week gives you, I think, 6 or 8 exercises, and then the one that we're going to roll out this coming Monday will show you an additional 6 or 8 exercises. So I would start, and then if you have like specific parts that you want me to go through, then just send me a message.
Can I just butt in? I'm the same. I'm not going anywhere. It's like I'm lucky. I got a small alley next to my house, so I have been running up and down the alley. But I've been doing a lot of the YouTube exercises, and there's something called team project management, and they're really good. And they do from beginners all the way up to intense, and there's nothing. Some of them you don't need. You don't need any supports or this stuff that you will use. I forgot what they called. What were they called? The weights. You can either use weights or you could do it without weight. Even my husband was doing them with me, and he's got really bad issues with his knees. But I just thought I'd butt in just to let you know that's the ones I've been doing, and they have really helped.
Where are you from in South Wales?
Porth, I am.
Ah, I know Porth. I'm Bristol.
Oh, not too far away from me then.
Oh, I'll stop doing the accent now. Can't help it. Oops.
Okay, so can we proceed to the other question if someone else has?
Sorry.
Okay, so I have another question by one of the followers. Okay, so she has.
Hello.
Hello.
Yeah.
Yeah.
I have one question. For the past few days, basically, whenever I'm waking up in the morning, I'm having a pretty, you can say, significant dizziness kind of a thing, which basically I'm facing. So I don't know whether it is purely because of that lockdown thing, because I mean, basically, I've been sitting in my home for so long that, I mean, that is the case, or is it something else? Because, I mean, it is there for almost 1.5 hours in the morning. So,
And
I
then
just,
does that stop? Does the dizziness stop?
yeah, it stops during the day. So basically it is there in the, but during the day when basically, whenever I'm having food and I'm doing some kind of basically activities, I mean, it kind of reduces and then it stops by the afternoon or something. But in the
Do you
morning,
feel like when you turn your head one certain direction versus another that you get the dizziness?
yes, if I do it, you can say like swiftly, it is there. But while moving it slowly, I mean, I don't feel that way. But whenever I'm moving it like my head in, you can say, in a faster way, I mean, I feel that kind of dizziness. And it is there. I mean, in the morning, it's there. Even I'm basically sitting and I'm slowly walking also. I mean, I feel that thing. But you can say,
Yeah, so vertigo,
yeah,
very common with MS. So there's a lot of exercise that you could do for the vertigo.
okay.
You have to figure out what position. Sorry, I'm positioning to a different area. You have to figure out which area, causes you the vertigo. So it can be if you turn your head quickly to the right. It can be if you turn your head quickly to the left. But if it's coming from the neck, then you could do some exercise like chin tuck. So if you have a band with resistance, you can just kind of retract your chin or give yourself resistance looking to the left and the right. You want to figure out what is causing the dizziness. With MS specifically, vertigo is very common. There are certain positions, there's certain maneuvers you do called canal repositioning maneuvers, or something called the Dix-Hall Pike. I'll type it in the chat. That way you guys can see. But I would go to a ENT, because they can help you with all of that. But I'm going to type in the chat right now the Dix-Hall Pike maneuver.
Okay.
That usually reduces the vertigo if it's true vertigo. So I type that to the chat that we could kind of Google how to try some of the stuff at home. But if it continues, like if you feel like a spinning sensation, that's a vertigo. And I would check out a ears, nose, and throat doctor that can help you with vertigos because they know how to do those maneuvers in their office.
Sure. Thank you, doctor.
Just one warning, I've just got a message from Zoom. The meeting will end in 10 minutes and you can join back again, right? Because there's a cap of 40 minutes in Zoom.
Okay.
Yeah. So as far as vertigos is concerned, I remember that even I had bad vertigos. It was like really bad. I used to get up with a heavy head and I could not even stand on my feet properly. It was like that bad, did not have any kind of balance. Then I used to, I had to just lie down for like 1 hour or 2 hours till it used to get little better. And then I could just walk for some time. But then I remember that I actually had to take some medications for it. It was bad in my case. I understand it will differ for different people. But for me, when I had got relapse, and in fact, after that also, in between, I did get a lot of form of vertigos.
Yeah, they usually give meclizine as the form of medication for it. But, the dizziness could be from the neck. It could be visual. A lot of times people are utilizing the computer, especially now working from home. So it's really important to figure out what is the cause of the symptoms so we know that we're treating the correct thing. The main thing with vertigo is you just want to make sure that you're not quickly getting up or turning your head like really quick to the right or the left, because that's what can increase those symptoms.
Right. Yeah, I could not that time. Yes. Yeah. So any other question that someone would like to ask? I just saw Abby unmuted the phone. Do you have any question, Abby? I just see a question by Seth. He's written on the chat. He's written, Doctor, these days I feel some kind of a fullness in my chest, or I feel like I can't breathe deep enough. This is most temporary and I don't really feel breathless. Just a weird sensation in my chest. Is there something you can advise I should do? Any exercise?
Yeah, so if the tightness is coming from the chest, really the main things you want to do is really stretch out the pecs. So doing like a doorway stretch where you have one arm up and the other arm, you kind of lean forward, hold it for a good 30 to 40 seconds. That way you can stretch out all the muscles in the chest here. Or you could stretch out the front of the neck muscles. So kind of having like one part of your arm depress your collarbone and look up and out, so you feel the stretch all throughout the front. And really doing a lot of middle back stretches. That those symptoms that you're describing could be really more from the ribs. It could be more from the muscles in between the ribs, something called like costochondritis. Or if the stress levels are really high and it's kind of causing like an anxiety, that can be the answer to those symptoms as well. So I would say keep your posture upright so you're not kind of flexed forward and allowing all those muscles to tighten up. Do some pec stretching. Do some kind of anterior neck muscle stretching for the scalenes, because those muscles attach to the ribs that can inhibit some of the deep breathing, and really just try to work on some relaxation techniques with deep breathing associated, so you don't feel like everything is kind of bottled up. But if there are stresses that's causing increasing anxiety, that can cause those symptoms as well. So really just try to do some like meditation that can help.
Okay. Isa just joined us. How are you feeling, Isa?
Hey everybody, sorry I was late in joining. I forgot. So somebody gave me a reminder, Angie, I don't know. How am I feeling? Honestly, like shit. I can't seem to make any ground on whatever's going on. I tried to do a little bit of what we discussed, Doctor, in the pool the other day. I didn't really record it because it was very quick. I didn't want to push it. It was late in the afternoon, and I just wanted to test the water, so to speak. And the next day I was totally wiped out. So I'm not ready for anything like that yet. I've even been scared to stretch. That's how sick I've been. I'm, no offense to your profession, but I'm really over doctors. I've been sick for 46 days, and I counted because those of you who follow me on Instagram know I document everything in real time. And I put the real shit out there. Like, even if I look like this, I don't care. And I just can't comprehend how I'm still sick after numerous calls and numerous very direct explanations on how sick I am. And I don't know at this point. I was supposed to have an MRI. What's today? I don't even know what date it is. What's today? Saturday? Yeah. I was supposed to have an MRI Thursday night. And, you know, they didn't really sense the urgency, even though in the order was stat. I'm not getting one now till Tuesday. So I'm sure everybody out there that's dealt with doctors understand where I'm at. At this point, if it's a relapse,
corona,
I think
you're saying, or the relapse?
Pardon?
Is it mainly because of the corona they're saying relapse?
Well, this is what I've been told, that I do have COVID. They're convinced, regardless of the test being negative. They say that the duration of my illness is an indication. It's an atypical presentation, that if I did have the presentation up here, it was probably very mild, and I guess it traveled to my gut, and I'm trying to address that and addressing my energy as well. But so I posted on my story yesterday, like, I'm not really even sure, honestly. Like, I don't know what to believe at this point, because I've been on my own for so long, like whether it's COVID and it triggered an MS relapse, or it's just a pseudo exacerbation, which has lasted a long ass time, or it's a relapse of some sort.
I don't know. I'm really at a loss. I feel like I'm on my own, that it's quote unquote in their eyes mild, but from where I sit, there's nothing mild about this. When I got into the shower finally a couple days ago, after I just washed this mop of hair, I had to sit down in the tub. I couldn't even stay standing. That's how weak I am. As you can see in my face, I don't look all that healthy, do I? I don't know. So how I'm feeling is, physically, I am struggling. The muscle atrophy at this point is my biggest concern. It's very scary to see me naked, honestly. I don't like to even look in the mirror. It's gotten to a point where now I'm even wondering, and this is something you could probably chime in, doctor, and let me know what you think. When you're sick this long with, I guess, any illness really, but of course we're talking about MS, and muscle atrophy sets in, because I know a little bit about the anatomy of the body. That's where it's going to go to get its nutrients to survive, is in the muscles, which is why it sets in so fast, and why I've disappeared by like 7 pounds now. In 46 days, almost 7 pounds. That's a lot of weight. That maybe that's compounding my ability to try to get back on my feet. But when you don't have strength and you're weak, and anything you put into your system, you're not even sure you're going to keep down, how the hell do you make ground on that? How the hell? Like, I don't even know. Honestly, I'm at a loss. I'm trying everything. Like, Angie and I have been talking quite a bit. And I've gotten on more of a protein shake without the whey in it, more vegan, some supplements that will help me with energy and things. But I think that I'm in such bad shape that stuff is going to take a long time. So I don't know. I guess that I'm at a place now with all of this that I don't know what to do next. I really don't. It's just like almost to the point of yeah, what?
But listening to Isa, I have this question, it's normal for us to feel such kind of fatigue, such, weakness, energy. In this case, we understand important for us to, guys, go back to your own life. Why going back? This is quite often, that people do feel lots of low of energy and lots of fatigue, not because of relapse. Sometimes it just happens, just like that. I don't know why. But we know that it is important for us to get back and start exercising again. But also we cannot, because we are very much low on energy. What do you think, whether we should listen to a mind or whether we should listen to a body? So they say that you should keep a balance between listening to your mind and body, and just work out no matter what happens. What are your thoughts on that?
Yeah, so I mean, in this state, when things just aren't improving, and it has been so long, a month and a half now, really the main thing is just trying to stay as positive as you can. And really, this is kind of like a longer break than expected, but just, mind that hopefully this is just very temporary, and that very quickly you will start to feel better, and just try to stay positive, because really what we don't want is to kind of go down in this path where nothing is getting better for a month or a month and a half, and then we start thinking that it will never get better, because the mind has a lot to do with it. So if we can train ourselves to try to stay positive and look for other members within the community that also might have MS, and kind of look for them for some support, that's the most important part. Try not to go down in the path of like the unhealthy eating and all that, because that will exacerbate it. But really just try to stay positive, and keep yourself active as much as you can, but don't overdo it where you feel wiped out for the next 5 days. Like getting in the pool was the start, so maybe it didn't go well week 1, but maybe next week it'll be a little bit better. So as long as we can try to make small improvements week by week, then that's a sign in the right direction.
I have a personal question here to ask you. One is that, like, for example, I'm taking Avonex as my DMT. So I've been taking it last 7 years now, and when I took initially, doctor said that probably after a year or two, the symptoms will go less. It did decrease, but I still, have to be on bed for 24 hours after taking it. I still get fever. I still get fatigued. I have pain and lots of uneasiness in my body. I do not know how to describe it, but I just feel very uneasy on my legs. My hands feel really uneasy, and I really don't want anything, not even a blanket touching my legs. It's like so bad. So for 24 hours, I'm in such an uneasy state, and after 24 hours, sometimes 48 hours, I become numb. So I feel that 2 days or one day of my week I kind of dedicate to MS, the recovery after taking Avonex. So I just want to ask you, in this kind of condition also, I'm like totally dead kind. Do you recommend anything that I should do to feel better, maybe before taking Avonex, so that after I take my medication, that thing would not come, or my uneasiness or the pain will not come so much? Is there anything like that I can follow?
So, from a medical standpoint, because I'm not a neurologist, I'm not really familiar with that specific medication. I would say more so that's an appropriate question to discuss with your neurologist, or talk with some of other, members in your community, see if anyone else is on that medication, if they get the same symptoms. If they do, what did they do themselves to kind of help overcome them? Because I'm not a neurologist, so I don't really know the interactions with the body of how specific medications will interact, but I would more so kind of try to discuss that with them, as well as other community members that maybe, might have a different strategy. But I'm always like more of like the all natural path, like homeopathic. So I would see if there's certain maybe essential oils that can help with the recovery. Or I know last week we discussed a little bit of acupuncture, but I would try to see if anyone else personally is on that medication and see what they've done to reduce some of the side effects.
Essential oils can you suggest?
I don't have a specific one. My background is more of like really suggesting appropriate exercises and workouts as a physical therapist. So, I know there are a lot of essential oils. I don't like sell the essential oils, so I don't have these specific ones, but I would, I know there's a lot of MS groups like on Facebook and stuff too. Maybe pose a question of, hey, has anyone used essential oils after taking this specific medication, or has anyone taken this specific medication, and how has your body responded positively after the fact?
I think Avonex is bad for everyone, whomever I've spoken to.
Yeah, so I don't know if you're having this bad reaction, because you're saying it happens once a week.
Yeah,
right?
because once
So
a week I have to take these medications.
Yeah. So I would 100% maybe discuss that with your neurologist, because, there's so many patients with MS that we interact with, and everyone is on, there's so many different medicines, so many different treatments. Sometimes people are on biweekly infusions, sometimes they're on quarterly infusions, sometimes they're on, an injection versus a pill. So every neurologist has a specific type of medication that they put their patients on for whatever reason. If you're having a bad reaction once a week, to me, that sounds like a lot. So I would talk to your neurologist and see what other options there are.
And accepted, all over. So you
Say that
think,
again?
I think this is something, given and accepted, that with this medications, you will have this symptom and you'll have to bear it. So whenever I ask any neurologist, he's like, it's fine. You just take some paracetamol to reduce the symptoms. And when I've asked the other people also who have taken Avonex, the review is kind of same. Everybody goes through such things.
Yeah.
So the best thing I try to do is take something very healthy, eat something healthy, so that doesn't affect me much. Yes, Angie, sorry.
I'm a huge essential oil user. I have been since my diagnosis 16 years ago.
Okay.
And I purchase and I only work with Young Living oils because they are the grade of them, they're pure. You could actually ingest them. The crap they sell at the big box stores, I wouldn't put near my cat. It would kill her. So if you end up going with an essential oil, do your research. Young Living oil. I know there's another company called doTERRA, but I have been living and breathing by the Young Living oil. The Thieves is antibacterium, and I put it in my mask when I'm out in public. I have the cleaning supplies. The Copaiba is amazing for muscles, for spasms. And then I mix it with wintergreen. If you just go on their website, you can learn so much about these products. My chiropractor and acupuncturist, I bring them in with me. And when I'm getting my treatments, they use all the different oils. I bring my whole kit. I ingest the lemon every day. But my sister was on Avonex. She had gotten to the point where it was just too bad for her. She was on such high doses of Benadryl, and she'd be sick for so many days after that her quality of life just, and then she jumped to another. But if you drink chlorophyll drops in your water, it's a good digestion. It's natural. It has a delicious minty flavor.
Okay.
It's chlorophyll. It helps with your gut health. And it's amazing additive to, I've been drinking that for 16 years as well. And it's like a detoxifier, deodorizer for your body. And gut health with MS is truly important. So if you guys, I get mine on Amazon. It's cheap, the brand that I use. And my girls that went away to college, they drank it the whole time and didn't have like that freshman gut issue that people have. This is it, Nature's Sunshine.
Okay.
I don't know if someone wants to screenshot it, but it's on Amazon. This bottle could last like 3-4 months, depending on how much you drink. But every glass of water that I drink every day looks like a swamp. I love it. It's dark green and it's just great. So anyway, I feel like that it helps with when you put those medications in your body, the more you can stay hydrated and flush out the toxins. I feel like it's only beneficial to get you through it. So that's my 2 cents.
Thank you.
Yeah, that's great advice, because I want you guys to find what works, for your bodies and share that information. So like the Young Living oils, I did hear those were definitely pretty beneficial. So I think those are the ones that I have in my house too, but I don't know.
Not that I'm promoting a particular brand, but I know that these are high grade, and the stuff that they sell in the offbeat stores that people put in diffusers in their homes can actually kill your animals. And there are certain ones that I can't have in my home because I have a dog and a cat. That is, I think Eucalyptus is one of them. It's highly toxic for them, but it's wonderful. It's another layer of self-care that have felt worked for me. And I just like to share all these different little tidbits, because when I was diagnosed, what I was told from my neurologist was, you're going to have to, you're buying a home, you're going to have to make it handicap accessible, because that's where you're going to be. And that's not the case. So people
that was bad advice.
Terrible. And they dropped me 3 years ago, my neurologist, because I refused to commit to a DMT. She told me she would no longer waste her office hours with me. So I shook her hand and I walked out the door. And it's sad, but anyway, they don't appreciate when you extend yourself to incorporate other therapies. They only believe in what they believe in. Some doctors. There are others that I've seen, you know, support, like the one I got now. She supports what I do. So, and she learns a lot too. She's like, tell me more. But I think like this forum that you've created, you have people who were diagnosed yesterday, people who are in the process of being diagnosed, people who are in relapse, people who are thriving, and we all get to hear these stories and grab tidbits. And I think it's amazing. And, you know, thank you.
Thank you. So yeah, so speaking of this, the DMTs, you know, for me, touch wood, I've been doing good with Avonex since last 7 years, and that's the reason why my doctor doesn't want to change to any kind of oral medications also, since he said that you're doing good on it. But seeing everybody, you know, even I do get the inspiration that, you know, maybe I should just stop my DMTs, you know. I should also start living naturally, but let's see. Maybe I did not have the courage still. Probably, let's see. Okay.
Speaking of Avonex, I heard that interferon is actually helping with this whole COVID-19 coronavirus. Like doctors are actually using interferon to treat coronavirus. Is that true? And how's it working? I mean, isn't it supposed to reduce your immunity?
Is that question for me?
Yeah, yes, Doc. It's a general open question. Like,
Yeah,
I just don't get it.
I'm not really, so I'm a physical therapist, so I can't really answer like those medical questions when it comes to drugs.
Right.
So I don't want to give like non-evidence, non-factual information.
Right. So I'll just say this. Yes, I had posted this about COVID-19 and interferon a few days back in MS News. So the thing was that some of the doctors are using interferon along with the HIV medicine and malaria medicine. And the combination of all these is actually working on the COVID patients. And it has been seen that a person who has COVID and hospitalized, if that person gets discharged in 3 days, if a person is taking interferon, then that person will get recovered a week earlier than the normal 2 weeks tenure. So it is being noticed that interferon is helping people vis-a-vis some of the other medicines which they say suppresses your immune system. But interferon doesn't suppress the system, yeah, it has its own side effects. So this was one of the news which we got from the news clinic, but we do not know how many people and how many countries are actually using this. Moving on to the other, some other question for the doctor.
Yeah, I've got another one. Doctor, so lately I've been having a lot of stiff neck and I feel like cracking my neck, you know, like at least twice a day. And last night something scary happened, so I was cracking my neck again. I shouldn't, but I did. And I felt a very weird and strong, like a current-like sensation in my right hand, to the point that my right hand involuntarily, it just shook really hard. And I had this pain in my neck for like the rest of the night.
Okay, so that I could definitely help you with that. So if the neck is very stiff, it could be stiff from muscles. It could be stiff from the joint itself. If you kind of like self-adjusted or self-manipulated the neck and then you felt that current rush down the right arm,
yeah,
that's like I would say don't do that again, because that means like a nerve is being pinched a little bit. You might have loosened it up if you might have got more range of motion, but if you're feeling like more pain the rest of the night, I would ice it up. But if you have pain like on this right side, you really want to just try some gentle stretching. So what I would have you do is like put your left arm on top of the head, more on the side, and then nice and gentle, just kind of stretch. You don't want to yank your head. You want to keep it here, and then nice and gentle, bend away. So
okay.
you feel like stretching the upper trap, or you can have your arm this way and look down and over your left side. That stretches more the shoulder blade. You know, another one that we could try is if we have like a towel, you could put a towel between the head here and just kind of wrap around and give yourself some stability. Stretch out your middle back, those middle just a little bit looser, then that'll help your neck move. But I wouldn't try to do like the self-manipulation or mobilization to the spine because, yeah, you can hear the crack. It might feel good initially, but you don't want to kind of like make it unstable. So the fact that you felt that pain shoot down your right arm is probably because that nerve is being like pinned from home. Trying to have your neck like this, you know, if you're like typing on the computer, you don't want to have your phone on your neck because that's going to pinch that side. You don't want to sleep on 3 pillows because that's going to kind of increase the neck position as well. So you just want to make sure you have like a nice posture throughout everything. And really the main thing is to watch with the phones, because a lot of people are like this on the phone while they're typing, and that could maybe be why that neck is stiff on that side.
Got it. Thank you.
Does that help?
Yes, very well. Thank you, doctor. Also, doctor, I noticed that you're wearing a MUC's t-shirt. Did you like participate in the MUC Fest?
Yeah, so I wore that for this chat today. 5 years ago, I had an individual that I started treating in my clinic. So what happened was I'm from New Jersey, and these individuals that I know, they made this kind of 5K obstacle course for all individuals, not just with MS. It was for disabilities, and there was various kind of obstacles that you can climb up or down. And my patient with MS, she was able to complete this with her family, and she loved it. And MUC Fest was coming around. This is when we first got associated with the MS Society in New Jersey. So we decided, it was a team of 16 of her and her family, and it was about 12 of individuals from my company where we all helped her out with her treatment plan. So a total of about 30 of us, we were on a team, and we helped her complete MUC Fest. So we actually did it with her. For anyone who's not familiar with MUC Fest, it's 16 obstacles. It's a 5K, so about 3 miles. But it was an awesome experience. So every year since that, we've been sponsoring MUC Fest in New Jersey, and we've been completing it with various patients. Last year we did it with my one patient, and it was fantastic. So this year it's supposed to be July, I think 15 in New Jersey, but that's going to get pushed back. So I don't believe we're going to have the opportunity to do MUC Fest this year, but for the past 5 years I've been doing it.
It's very cool. I'll just say one thing, doctor, that you both are very, very informative. And, you know, I was just thinking that maybe it would be great if you could do like a podcast together. You know, you guys are full of information, and I would love to listen to you guys, you know, while driving or something on iTunes or something. I think guys should do a podcast together. Just an advice, just a suggestion.
Yeah, I mean, we did this for the first time last Saturday. And then from there, someone asked a question of like what exercise to do post exacerbation. So we said for the next 4 weeks, we'll kind of post MS Mondays videos. And, you know, normally I'm traveling a lot on the weekends and I have a lot of stuff going on, but everything got canceled for these next, I think, 3 months. So I told her for the next at least 4 weeks, we'll be doing this on Saturdays, but I mean, I can kind of keep this going for a while. And, you know, I would be interested in, I can definitely do a podcast as well.
We can talk about it, of course. That's a good idea.
I'm open for trying to, you know, deliver information for everyone out there, because there's millions of people with MS, and, you know, I think there's already more people that joined this week's session than there were last week. And there's some of the same people. Like I know Claire was on last week, and Angie and Isa. So, you know, I think the more we do this, more individuals will join. But I'm all for keeping individuals active and helping you guys, you know, stay active and give correct information, because how I think it was Angie, you said your doctor said, well, if you're moving to a new house, you got to make it accessible for handicap. That's terrible advice. And, you know, there's a lot of terrible advice that I hear doctors give patients. That's why I'm happy I'm a physical therapist, because my advice is usually stay active. Let's see what we can do to help you do what you want to do. Not you have MS, you can't do this anymore. Because one of my patients a long time ago loved to ride horses, and her doctor straight up said, you can't do that anymore. But I don't want to tell somebody you can't do something. I want to try to help figure out how can we do something, even if it's modified. Let's try to figure out a way to keep your goals, active.
Well, I was told in work one day to stop putting my posts up on Instagram where I was running and where I was doing all these activities, because it doesn't look good if I've got fatigue in work. That's what I was told. And we work with residents that have got MS. So I was really annoyed about it. So all my post in the future then was MS and what they say about running, about exercising, and that it's good for you. So I think she got fed up of me putting the post up, because it really annoyed me, because I thought, how dare you? When if I want to get out there, if I can, bearing in mind my sister has got second progressive MS, she gave up and is now in a nursing home in a wheelchair because she gave up. I'm not giving up, And I thought, if you don't like what I'm doing, then don't follow me,
Yeah,
Just
I mean,
saying,
help motivate others. That should be the big key. Is there's a lot of patients will get a diagnosis, and then there's two things that can happen. They can either try to take that diagnosis and move forward, or they can let that diagnosis kind of dictate the rest of their life. But no matter what diagnosis you get, not just MS, but anything you could choose, it's really what you choose to do with it. So having people that you follow to kind of look up to as motivation is a positive thing, because if you kind of think that you're going to end up in a wheelchair, then that's how you're going to end up.
Yes. Doctor, I have to say you have been very kind, doing all these sessions. In fact, there were many other people who wanted to join, but because of the time zone difference, they could not. For example, there is a lady I know from Sydney who actually suggested me in the first hand, let's do a Zoom meeting, and she herself is not available because it's a 14.5 hours difference between US and Sydney. So
Right.
otherwise, there would have been many more people. So anyways, do we have any other questions to ask the doctor as of now? Isa?
I'm sorry, my internet has just been crazy. Just really quick, based on what happened to me when I tried to get in the pool and the next day just being flat on my back, I'm afraid. I'm afraid to get on. For example, it's raining here today in Miami. I would love to just get on my yoga mat and start a little stretching, or just to get my body blood moving, but I'm afraid. I'm afraid to do it because I don't want to I don't want to crash and burn again, and if it is a relapse, or if it's not, if whatever it is, I really at this point don't care. I just want to try to get my strength back, little by little. I'm just afraid. So I'm just asking, you just said, and I listened, you encourage your patients to get moving, but in this situation where it could maybe do me harm, how do I gauge that? I'm really struggling, and I've had this disease now for 8 years, so I'm new, but still I'm not that new because I educate myself, and I'm an athlete. So I guess that's my question, is how do I just roll the dice?
Yeah, I think we cut, because I think when we got cut off and we signed back in, I don't think you were on yet, but I really said, you're in a tough situation because it's been over a month now. But really, I would recommend just try to stay positive. Like, I know you're not starting to feel better yet, but just think that eventually you will start feeling better, and try to stay as positive as you can. And I would try to start with some of the more basic stuff, like maybe not get in the pool, but maybe just try some stretching, and just trying to sit and stand 10 times, in the morning, middle of the day, and at night, and just keep yourself at least the movements active. I wouldn't say go out and do a full hour and a half workout, because that can maybe do a little bit too much. But I would say, yeah, try 15 minutes today, 20 minutes tomorrow, half hour at the end of the week, and just try more gentle stuff, because getting in and out of the pool could also be a little bit fatiguing. So maybe start with some easier things, just on the ground, similar to what we did, bridging, standing up from a chair a few times, and just doing some heel raises, toe raises, just kind of work a little bit of everything. And then You could also do seated. You don't have to stand up. You could do seated marching. You could do seated like ankle pumps going up and down. You can, you know, grab a TheraBand, and if you have like a TheraBand, just kind of pull apart. So you just trying to do like, yep, exactly what Andrew's showing. How'd you know I was gonna show that?
I the whole time.
You know, just or a really good one that I like is if you have a band that's looped, put your feet, you know, I'm gonna show you real quick on my feet.
Okay.
See if I can turn this. Hold on. So like if you have just kind of have the band here and just try to move your ankles up and down, or have the band looped around your feet, right?
Yeah.
And try to do like some abductions.
Okay.
Hold for 6 seconds. Just so you get the hips moving. So it doesn't have to be you don't have to be doing jumping jacks or a bunch of stuff standing up. You can start with some seated stuff, like while you're watching TV, you know, do like 30 reps in the ankles, 30 reps in the hips, 30 reps arms, and then just take a little break. That could be a video that I can, you know, shoot next time. Let me see if I can.
Yeah, because I saw the other one that you posted, and I was like, all right, I can do that. And that's what I tried to do in the pool, and I just died. I was like, okay, no.
The one thing that,
you know, sorry, you can just have the band here, just do some pull aparts, or, I mean, standing on the band, like you literally do so many different things. You can do just like, you can have it here, work the wrists. A lot of times individuals will drop items. You can have abduction, bring your arms out to the side. You can go straight forward with your shoulders. You can do, you know, like even something just like holding it here and do like a little press. You know, that's just the arms. So you don't have like a full hour. You can just really take a band, something light to start if you have different resistance. And from that, just start with like one round, you know, but somebody was complaining about chest tightness earlier. So one of the best things is really just having it, pulling the band apart, because now everything through open, because many times people are kind of like this, everything gets tight through the front. So if you have it here, open it up, or you can even go like behind your back. But having it this way, doing some Pilates twists are really nice. Get that truncation. But I would start with all of that stuff, you know, because anyone, you know, unless one arm is so weak or like where you kind of feel like it's like paresis, you can just start with doing some pull aparts. You know, it doesn't have to be anything crazy, but start light, see how it feels, have your foot up here, ankle good, ankle plantar flexion. And then the one I was showing earlier is if you have it like looped around, just opening the knees, holding seconds. This is like the machines that they have at the gym.
Yeah.
And then come back, because that's going to work the glute medius, which is the most important muscle for stabilization and keeping your balance upright and everything.
Yeah. Can't tell you how many times I've fallen already. So great. Yeah, I'm familiar with a lot of that because I do that just for warm-ups and yoga sometimes, and I just incorporate it. So yeah, I'm just gonna try like a 10-minute, 15-minute kind of thing and just keep it very, very light. Maybe not even use a band at first, just kind of try to open it up and just kind of, you know, give my whole body some movement. Last question. I roll out my body a lot. T-bands and shoulders and, you know, a lot of my rotator cuff muscles. I should probably wait on that. Might be a little bit too traumatic for the body right now, correct?
Yeah, you could try it out, but maybe instead of rolling out, because that's going to involve getting up and down from the floor, just gentle stuff, like just bring your arm across, you know, through here, stretching out the neck this way. Hamstrings, you could just have your leg up and just lean forward. Like right now, I feel that stretch. For, you know, stretching out, I would recommend a hold to stretch for anywhere from 45 to 60 seconds. A lot of times individuals will stretch and they'll just kind of hold it for like 10 seconds. That's not enough. They at 30 seconds, but if individuals are stretch for a good minute. But I would, you know, you can do that seated too. Just bring your leg kind of like across that way and get the piriformis. You can like across and just kind of lean forward. A lot of stuff you can do all seated.
Okay. That's what I'm going to start with then. That's my project for today. We'll see how it goes. I'll report back to you next week. If I have the energy to record it, I will, and I'll tag you in it, and you can like take it and use it however you wish.
Yeah, I mean, what I would start with, really, if the legs are tired, I would just do arms. I would just take the band, do this 20 times, step on it, do like 20 curls. You could try maybe a couple presses. I would work the wrists a little bit.
Wake it all up.
Wrap around, do the one where you bring your legs out, and the ankle. Start with those 5 or 6, and that would be good. And just do it once today. And then tomorrow, if you feel good, do it once in the morning, once at night. The next week, if you feel good with that, do it 3 times. Once in the morning, middle of the day, then end of the night.
Okay.
We have 8 more minutes to go. So if there are any other questions, please, we'll have to wrap up now.
I just want to say, Isa, when you said that you're afraid to get on the mat, that you're going to like make the MS worse, you're not going to make it worse. You may cause yourself more fatigue, but it's not exasperating the MS. So, and your body weight, you've lost so much body weight that exhaustion is from that as well. And that's why I think with the super hydration and, you know, getting those good nutrients in, but he just gave you some great seated workouts. I know you're going to bounce back. You are. You have your spirit's there. You're just in a cloud, and the sun's going to return. Just like it's raining there today, you're going to shine. You're on the other side of it. Believe yourself. You're on the other side of it. The long part is over. All right. Just like this whole COVID thing, the longest part's behind us, and we're getting there. So small steps. You're gonna do great, honey. Okay.
So even I've got MS since last 7 years now, and these 7 years I think I've got this relapse 2 to 3 times, and it has happened so bad that whenever I got a relapse, I'm not able to take any step forward, any step backward, not able to stand more than like a minute. You know, it has been like that bad, and it has been for me that I have to take help from my of course family members to walk like a baby again. I have to learn to walk like a baby every time. You know, my first time my mom was there, she was taking care of me, she used to hold my hand and make me walk. This time my fiance was there and he made me walk like step by step, like crawling, like the baby is crawling. But I know that this is temporary, it will just go. I know it used to make me really tired, really fatigued. You know, I used to say, no, I cannot walk anymore. I would just take 2 steps and I used to say, no more walking. But it just go away. You know, just believe in yourself. You have been living with it since the last 8 years now. I know you know how it is. And I know because of this COVID also and the lockdown, everything is becoming so depressing all around that you feel more, out of energy and low on enthusiasm. But trust me, trust yourself, you'll be fine. And for you especially, I have been following you ever since I've made this page, and I have been amazed by the kind of energy you have, the kind of post you put. I mean, it's just mind blowing. I cannot imagine you, thinking of, that you are getting depressed. I cannot personally. So just be strong. We all are there with you. Okay. So wrapping up, any other more questions do we have for the doctor today? Okay. All right. Thank you so much, doctor, for being with us today. And
It's fun.
Today we had lots of questions and today was amazing. Everybody did join, more than the people that we had last time. So next time we'll meet again, the same time, next Saturday.
That's
And,
good for me.
all right. Thank you so much, doctor.
If
Bye.
anyone has any questions, feel free to message me. I'll come up with we have a post coming Monday, but maybe the week after that we can post some things like seated TheraBand exercise similar to what we discussed today.
Sure. All right. Thank you so much.
All right.
Thank you. Bye.
Thank you.
Good day, everyone.
Bye.
Bye.
Okay, bye.
Very cute
Thank
baby.
you, everybody. Love you
Thank you.
guys.
Bye.
Hope you
Bye.
feel better.
Thank you.